So one of the most exciting questions in the aggressive lymphoma field is based on the 3 studies that were presented at ASH, the TRANSFORM study, the SUMA-7 study, and the BELINDA study, which all compared CAR T cells versus autologous stem cell transplant, which is the current standard of care in second line for these patients. 2 of these studies were positive, 1 was negative, and we will discuss and are discussing in many forums whether this will now be the new standard. I personally think the answer is yes. However, we will probably have to define a bit more in detail which population that will exactly be. It will be patients who qualified previously for autologous transplant, and in the studies, the patient groups included were patients who relapsed or were refractory within the first 12 months after the first therapy. And that, of course, narrows the population a bit on this high-risk population. And then there were some inclusion criteria which were different between the studies. For instance, if patients with a progressive disease at screening should be included in a second-line treatment with CARs, or if they should rather be treated with other therapies. And also to keep in mind in this regard is that we have a lot of new other agents, particularly bispecifics or CD19 antibodies, and also the coupled antibodies, which will come into this same area. So it's I think it will need a lot of discussion between experts, but certainly CARs are one of the new standards in second line.